Welcome. I'm Dick Larson from the Center for Wellbeing in Colorado Springs, Colorado. Rolfing is named for Dr. Ida Rolf, a woman who received her PhD in biochemistry from Columbia University at age 25 in 1920, back when it was rare for women to get a PhD. She was hired by the Rockefeller Institute to study fascia, the most abundant tissue in our body. She called her work structural integration. Her focus was on the structure of the body, how you stand, how you move, your alignment, range of motion, and so on, and particularly how your posture affects your everyday life. But the name structural integration is a pretty big mouthful. So people just started referring to it using her last name. Oh, you're going to get Rolfed. Oh, yeah, I'm going to get some Rolfing. Rolfing releases tension, improves posture, greatly relieves chronic pain. It enhances neurological functioning and balance and reduces stress. So let's talk about fascia and its importance in the body. Fascia surrounds every bone, every muscle, every nerve in our body. Everything is surrounded by fascia, and it does so within a continuous, unbroken sheath. Actually, each and every cell in our body is surrounded by fascia, meaning fingernails and eyeballs and your ears all have fascia around them. So fascia acts as a three-dimensional spider web in the body. And just like any spider web, if you touch any part of it, the whole spider web responds because it's all connected. It is possible to travel from the top of the head through the center of the body to the tip of the toes by hundreds of different routes, all without leaving the fascia connective tissue. Two Rolfers wrote a great book on fascia that I highly recommend. It's called The Endless Web, but the original title of it was The Shin Bone is Connected to the Neck Bone. Again, we're just looking at how it connects everything. So when we say the whole body is connected, it is literally true, and what connects it is fascia. If you've ever cooked chicken and you pull the skin up and there's this glistening tissue underneath, that's fascia. Or if you eat a steak and there's a tough fibrous streak of white tissue running through it, that's fascia. Or for you vegetarians, although it isn't actually fascia, if you peel an orange, all of the orange slices inside are surrounded by a white material that holds it all together. It isn't fascia, but it acts just like fascia does. So Dr. Rolf discovered that it is fascia that holds tension in the body. It holds tension, but it doesn't know how to let go. The body is playing it safe, keeping things stabilized, which is what the fascia is doing. So because it surrounds individual muscles, when somebody says, oh, my trapezius is tight, it is not the trapezius muscle that is tight. The trapezius is a muscle. It only contracts in response to a nerve impulse. What is actually tight is the fascial envelope around the muscle, which then leads to an uneven pull on the tissues in the area. Fascial restrictions can pull the body out of its normal alignment, compressing joint surfaces and bulging discs, and this results in pain, loss of motion, and weakness. The fascia throughout the body is interconnected like the yarn in a sweater. A restriction in one area of the body creates tension throughout this web, pulling on other distant structures. This explains why some people may have pain that appears unrelated to the original injury. Furthermore, fascial restrictions don't show up on common standardized tests such as X-rays, MRIs, CAT or CT scans, etc. So if somebody goes to the doctor and says, my back hurts, my neck hurts, and they take an X-ray, an MRI, a CAT scan, they won't find anything because it isn't showing fascia. So none of that will actually show that it is fascia that's causing your hip pain, whatever your distress is. Fortunately, God gave us these amazing sensitive instruments at the bottom of our arms where we can listen to and read the body and find those restrictions and be able to address the problem without surgery or other invasive efforts. Here's a quick way that I introduce fascia to my clients. Grab your shirt or blouse or whatever you have right at the navel. Pull it straight out and then straight down. Do you feel that in your neck? Of course you do. So when someone comes in and says, I've got neck pain, they expect me to work in their neck. But if I only focus on the neck where the symptom is and ignore that there's this tight restriction down here at the navel, whatever relief I give them will be very short-lived. So as an example, suppose that you step off of the curb and twist your ankle. Now the ankle hurts and you can't put weight on it. So all the fascia around the ankle tightens up to stabilize it, kind of like an ace bandage. But because it hurts, I can't put the weight on it, so my body naturally shifts my weight to the other side, to my left leg. When that happens, this hip will come up. The body counterbalances by dropping this shoulder down. Now, because the shoulder is dropped, my head and neck have to start to change position, and it's all these blocks that I was showing you are starting to actually misalign in relationship to each other. Eventually, you're going to reach a point where you're going to have a neck ache and not realize that it actually began 20, 30 years previously when you twisted your ankle. Again, that fascia is all connected, and so things will show up elsewhere in the body that aren't actually logically understood, but they are. I'm so fascinated by fascia that when I dove deep into acupuncture and went after a PhD, I did my dissertation on fascia and how it's tied to the acupuncture meridians and their relationship to Rolfing. So back to Dr. Rolf. She realized that the tension in the tissues leads to the blocks of the body becoming turned, twisted, and tilted in relationship to each other. She also recognized that the predominant force impacting our bodies all day, every day is gravity. 24 hours a day, there is a pull straight down towards the center of the earth. So as we grow and get injured, for example, learning to walk and falling, having an accident on our bicycle, or injuries that come with sports and gymnastics, falling out of a tree, all the things we do to our bodies through our life, digging a ditch, or maybe you grew up on a farm and helped the family to load heavy bales of hay. You can assume nobody in the family instructed the youngster how to properly lift and throw. So we injure our body, and the fascia accommodates the body, trying to reduce the damage done by restricting it to a single area. But remember that the whole body is connected. And so if there's a strain in the low back, that pulls on the fascial web, and then there's a neck pain, or maybe the knees start to be unsteady, or whatever might happen. Rolfing works by counteracting the effects of gravity, which over time pulls the body out of alignment. So again, this is out of alignment. So we've all seen older citizens who are becoming more and more stooped. By freeing up the fascial tensions, Rolfing will lengthen the tissues and release their pulling on the body out of alignment. This pull causes the body's connective tissue to become harder and stiffer, and the muscles begin to atrophy. Signs of the stiffening and contraction include slouching or an overly erect posture. The thing that this person is experiencing is actually the long, slow drain of an unaddressed compensatory pattern on a body. But in our culture, we just call it, he's just getting old. Dr. Rolf adopted this drawing of a child whose body blocks were turned, twisted, and tilted in relationship to each other. Most of us have had injuries in the process of growing up, as I spoke about a minute ago, and so the image on the left is a normal body paying the price for injuries and gravity. The aim of Rolfing is to bring these blocks into alignment with each other and with gravity, and that's represented by the image over here. We need 10 sessions to do this systematically, to oversee the entire structure, because although you may have a pain symptom in your shoulder, I know that just to work in your shoulder where the symptom is won't address the entire issue. I need to change how you are standing on your feet, the relationship between your pelvis and your rib cage, and more. These are pictures of people who've been Rolfed and how their body responded. This is somebody before any Rolfing, and this is after 10 sessions of Rolfing. Same thing with this woman, before any Rolfing and after 10 sessions. With Rolfing, the client is supported in standing straighter and, in the process, gaining height. When I originally went through my initial 10 sessions, I gained 1.5 inches in height. It isn't that I somehow grew, but just as a rag shortens when twisted, the Rolfing process will open and untwist the body. So who typically comes in to receive Rolfing? 3 main groups. Most people come in because they are and have been in chronic pain. My back hurts, my neck hurts, my knee or my hip gives me trouble. The second group who come in aren't necessarily in pain, but they're using Rolfing to help their body to work at a higher level. So athletes, dancers, those whose body works fine, but they want it to work better. The third group is wise enough to utilize Rolfing as preventative medicine. Perhaps they watched their parents deteriorate and they don't want to follow that path. Or they smartly realize that the consequences of having led an active full life is that there will be mishaps along the way, perhaps they seem to have healed from, but in the big picture, all of the disorganizations will have a larger effect than one can ignore. I've Rolfed many folks from all walks of life, from a 2-week-old baby to a 98-year-old gentleman. According to the Rolf Institute of Structural Integration, more than 1 million people have already been treated with Rolfing. This includes children and adults, businessmen, professionals, dancers, athletes, and people from various professions and lifestyles. One last note. Rolfing has a reputation for being quite painful. This is Dr. Rolf Rolfing a baby. Does this baby look like it's in great pain? When I went through my initial 10-session series back in the 1970s, it was incredibly intense. But by the time I trained, they'd already started to look at how can we get the same result without traumatizing the patient while we work. Now I find that patients tell me that their massage therapist is more painful. And every week I have at least one client fall asleep while they're getting a Rolfing session because it's relaxing, it isn't an attack. I'm often asked, how is Rolfing different from chiropractic? Chiropractic focuses on the hard tissue, the bones. Rolfing focuses on the soft tissue, the connective tissue, which is what holds the bones in place. Chiropractors love it when their patients get Rolfed because we free up the tension in the soft tissue, allowing the chiropractic adjustment to go deeper and to last longer. What's it like to get Rolfed? Clients are in their underwear, briefs for men, a bra and underpants for women. It feels like a slow, deep massage as I manipulate the connective tissue. There are many times when I'll ask you to make certain movements or to work with your breath. I suggest that you watch my video detailing my own personal story and how I got into Rolfing. I was certified in 1979, and this is 2023, so I've been doing it for 44 years now. I offer a free half-hour consultation if you have questions or you want to discuss how Rolfing might help you. Also, if you'd like to learn more about me, please view my video called My Story. Thank you for your attention.